Welcome everybody to this virtual conference on visual discomfort and its treatment using coloured filters. The conference is in memory of Christine Fitzmaurice, who used to work for Sirium Visual Technologies and organised conferences of this kind. She worked tirelessly to promote the use of coloured filters, and she was good at organising conferences, and she's a hard act to follow. One advantage of a virtual conference is that it can be worldwide. And today we have a great lineup of speakers from around the world. I apologize to any of our audience who are in Australia. We will change the time of the next conference so you don't lose any sleep. The next conference will be more of a hands-on how to do it conference, in which people who use precision tints in their practice tell us how they do it. But for now, we're going to explore the recent advances in research findings that help to explain why it is that coloured filters have their extraordinary therapeutic effects. I'm going to talk about the use of coloured filters in neurological disorders. But first, a disclosure. I invented the Intuitive Colorimeter and I've donated royalties to the University of Essex for students. And I received royalties from the Wilkins rate of reading test and the pattern glare test. As Karen's already mentioned, the Intuitive Colorimeter is, it's a box basically, and it illuminates text with coloured light so that you can vary the hue and saturation at constant luminance. And we've developed a hill climbing routine for alternating the hue and saturation so that we can select the optimal colour whilst the eyes are colour adapted. And having found the optimal chromaticity, we can ratify that using a selection of combinations of tinted lenses. We only need 2 dyes to get any colour. Sometimes we add a UV blocker, and as you've heard from Karen, sometimes a grey tint is necessary. And then the combination of tinted trial lenses is used as a prescription to provide precision tints in spectacle lenses. Oh, another little thing I should tell you about the rate of reading test, because I wanted to mention some recent work by Jim Gilchrist, who's shown that this test has extraordinarily high precision and reliability, such that a change of only 15% or 7 words per minute is outside the normal limits of the person's response rate. Okay, now that aside, neurological disorders, photosensitive epilepsy, autism, migraine, cluster headache, and stroke. First, photosensitive epilepsy, normally diagnosed by exposing a patient to flickering light whilst the EEG is monitored, and a sensitive patient will show a photoparoxysmal response. There have been a lot of studies that have looked at the effects of the colour of the intermittent light, one way and another. Half of them show no consistent effect, and half of them show some effect, often a reduction in brightness, as for example in the case of the Z1 lens, which is very dark. But many photosensitive patients are sensitive to patterns as well as flicker. So we did a study of pattern-sensitive epilepsy, 33 patients with photosensitive epilepsy, 23, that is 70%, showed beneficial perceptual effects and were given precision tints. And they were followed up after 2 years, just over, and 17 of the 23 were available, and 13 of those, that's 76%, were still wearing the glasses and reporting reduced symptoms, not always reduced seizures, but reduced symptoms of discomfort and so forth. The chromaticity selected by the patients is shown on the left here. The average transmission was 30% and the minimum transmission 21%. We did show reduced seizures in some cases, and in this case, there was no change in therapy for 5 years. And you can see the change in the incidence of seizures before the glasses and after the glasses. The glasses in this case were blue. Now, autism spectrum disorder. Now, most of the work that I shall talk about has in fact been done by Dr. Amanda Ludlow using overlays. she, in her thesis, looked at the rate of reading test and showed that 11 out of 19 individuals with autism spectrum disorder improved by more than 15% on this test, whereas only 1 out of 19 typically developing children did. In a second study, she showed that it was important to ask about the clarity of text seen through the filters, not about which color was prettiest or which one they preferred. And she also showed that it wasn't just reading speed that increased, but there was also an improvement in matching to sample, matching the item on the left with one of those on the right. Then she reported a case report of a 13-year-old boy who was diagnosed at age 4 with ASD and ADHD. He reported hot eyes in response to bright colors, leading to headache and nausea. He had a strong attraction for blue and purple, and good responses from a purple overlay. So he was given intuitive colorimetry in blue lenses, and this is the spectrum of the lenses. And you can see the gray bars indicate when the lenses were introduced. The white section in between is when he broke his lenses. And as you can see, the period of burnout which he experienced returned when the glasses were broken. Vomiting and hot eyes were eliminated, and social activities took off. Then Ludlow showed that the mind in the eye task of Baron Cohen is performed better with the colored overlay. The person has simply decide what emotion is being expressed in the eyes. And in similar vein, Lydia Whitaker, one of my students, showed that if you're asked to decide which of two faces expresses the greatest emotion, which is a holistic task, you have to look at both the eyes and the lips, that this is performed better when the screen has a color that people have earlier selected as appropriate for text. So all of those tell a consistent story, and in the recent days, Amanda has looked at the emotion evaluation task. This consists of 28 videotaped vignettes of professional actors enacting ambiguous scripts representing 7 basic emotions. The stimuli are dynamic, they're part of color video clips. They portray naturalistic, complex expressions, and they provide intonation and gestural cues. What Amanda did was to undertake colorimetry initially, and the results are showed by the very small circles that I hope you can see. They're connected, the circles are connected by lines, and the other end of the line represents the colors of the control lenses that we introduced. These lenses were selected by computer to be just sufficiently different in color. So 1 month later, when the children had forgotten about their color choice, Amanda gave the emotion evaluation test. And you can see that the children with ASD improved their performance with the chosen tint, whereas the children who were typically developing showed no effect of the tint at all. In fact, the children with ASD improved to above normal levels with the tint. So there's an effect in ASD of improving perception of emotions. Now migraine. Well, migraine and tints are all over the web, but do they work? In this study, which was 2 studies done by Amanda Aldrich and Alex Vieira, Amelia Aldrich, I apologize. They asked their participants to select a color in the Intuitive Colorimeter. And as you can see, the controls, that is those without headache, selected colors close to the Planckin locus, this line that I'm pointing to. This Planckin locus represents the colors that are available from everyday lighting, whether it's daylight or artificial. And you can see that some individuals chose yellowy colors and some chose bluey colors. but most of the colours chosen were on the plankin locus or near it. Compare them with the individuals who had migraine with aura, and you can see that the individuals who have migraine aura are choosing colours well away from the plankin locus. And this is the case in both studies, done by different individuals with different participants. So it looks as though it's a reliable effect. Does it matter? Well, we were able to show that visual performance improves with the tint. This is work again by Alexandra Vira. The subjects were asked to find the word shown at the top here in the matrix of letters, and then to touch the screen at the first letter of the word. And they were 40% faster when they wore their tinted lenses than without. There was no effect for the individuals who had migraine without aura or the controls. Now, cluster headache. Here I have just a case study, but it's an interesting one. A colleague of mine, in 1989, his headaches began when he was aged 26. Each headache lasted 45 to 90 minutes, and it occurred 3 to 5 times a day for 46 weeks, every alternate year. And I should mention that the pain of cluster headache is the worst pain known to medicine. It's absolutely horrible. Now, what he found was that his headaches were preceded by prodromes, and the prodromes built in intensity and frequency before the onset of the cluster period. He was seen at the National Hospital in 2002 and given subcutaneous sumatriptan and oxygen. But in 2014, he took part in a study we were doing of precision tints. This is the tint he chose. It's a greenish colour. And he wore the tints when his prodrome occurred. He didn't wear them at other times. What he discovered was amazing. His prodrome didn't progress to headache. He's been free of cluster for 6 years with no injections or oxygen. So maybe one solution to cluster is to treat the photophobia that precedes it. And it's not just one patient. We now have a second who reports that he's using his new tinted glasses regularly. They seem to be helping when the prodromes begin, but he's saying, hang on, because his cluster headache cycle begins in earnest around Christmas time. So I wish him luck, and I hope, he's successful in preventing his cluster. Finally, stroke. 3 studies, all done by Ian Beasley and Leon Davies at Aston University in Birmingham. The first showing modest effects in improving reading speed in patients with stroke and in improving visual search. One case study of a lady who had a stroke and who found a specific colour helped her, and then unfortunately she had another stroke. That colour no longer helped, but she was able to find another colour that did. So her colour specificity changed as a result of the stroke. So I've described these neurological disorders: photosensitive epilepsy, autism, migraine with aura, cluster headache, stroke, and Karen has described head injury. There are 2 other disorders where there's just one study, so I haven't talked about those: Tourette's and multiple sclerosis. Now, in most of these neurological disorders, there's comorbidity with epilepsy, which would be consistent with the idea put forward by some of our earlier speakers of a hyperexcitable cortex. So maybe we have a new subdiscipline, which we could call neurooptometry, I suppose. Thank you.
Great, thank you. And Arnold, I have one for you. Was there any difference in reaction to coloured overlays noticed in red-green colourblind individuals?
Well, the curious thing is that no, is the simple answer. The curious thing is that the incidence of colour anomaly in those who suffer visual stress is just about what you'd expect in the general population. So Wouldn't you agree, Bruce? You're welcome to, you probably know more about it than I do.
No, just to agree with you, we've looked at this in a few studies and we haven't found anything unusual about the prevalence of colour vision defects in people with visual stress.
Yeah. Well, I wanted to bring in Olivier here, perhaps rather unkindly, because he's shown beautifully how a coloured filter can reduce visual stress, discomfort, and so on. But why should it be that people, I mean, I don't suppose you know, and I certainly don't know. So I'm kind to ask you, why is it specific? You know, why is it that, I mean, on the basis of our data, I would have thought any colour would do, any colour that reduced the colour differences in the scene. So it might depend on the scene you're looking at. But that doesn't explain why it is that colour helps with scenes that are achromatic, such as text, or why the colour chosen should be individual and specific. And that's the million-dollar question. We need some kind of behavioural physiological correlate of the colour chosen, and we don't have it yet. So does anyone on the panel have any idea where we should look for a correlate of the particular colour chosen? Sorry, I'm just throwing that out there as just to be annoying.
I wouldn't mind hazarding a guess, a very weird guesstimate. So the colour maps that are described at the end of my talk, where in V4 we see some perceptual colour maps, assume that everybody's got the same colour map that's equally distributed across the cortex and it looks identical. We know that brains do not work like that. Everyone's brain is vastly different. And so there might be some sort of map imbalance in V4, somewhere in visual cortex, that maybe these coloured tints, and I know this is something we've talked about before, Arnold, that maybe the tints are helping to rebalance in some ways. And then again, it's sort of going back to Karen's point about with the retesting, that map gets shifted, is adaptive, kind of corrects itself, and then at some point it needs another tint to kind of recorrect again. Yeah. That would be my 2 cents on this.
All right. So where would you look for the correlate? I know it's a million-dollar question. If we could find a correlate, it would be a huge step forward, you know, in explaining the phenomena and in getting rid of some of the disbelief there is surrounding this treatment. Oh well, maybe we don't know where to look. Maybe that's the trouble.
I was wondering if anyone
really sorry,
if anyone knows whether the stability of that colour map in terms of I'm thinking of the homunculus, and remember those diagrams of the homunculus, and I'm thinking about whether the spacing between just noticeable differences, for example, how idiosyncratically that varies, and how stable that is over time. I don't know whether you know of anyone who's looked at that. I don't.
I don't, I'm afraid. Gordon, why do you think it is then? Where would we look for a correlate, do you think?
I think Sarah's on the right lines. It has to be central, I think. I mean, because of what we know about color constancy and so on, it's once we get it into the brain, we're not really dealing with this wavelength equals this color, and of course, colors. We're not talking about the fact that the value or luminance also affects the perceived color. We have, you know, in the Munsell system, we're all dealing here always with white, the white level, and but there's also all of the different values, which browns and maroons and all of these different colors. They're all up there in the brain. And they're not ordered according to the rainbow.
Agreed.
So I think it's it has to be a central phenomenon. Sarah, we have actually seen patients well, we reported one patient who, from an occipital stroke, was lost the ability to see green, a specific color, and you can see even in V2, you can see this is beginning, where we have representations of the perceived color, and even taking into account color constancy and so on. And it's probably why there's such dense callosal connections between left and right V4, because the whole visual field has to be taken into account, right from a very stage. Yes. So I mean, we tend to think in terms of the wavelengths on the retina. That's just the start of the process.
It's just the beginning. Yeah. Well, I think that probably. So there's so much more to be found out. Well, that's probably a good way to end. But I'd just like to thank everybody for coming and for a stimulating discussion and for some lovely talks. And thank you to our audience for watching.